We are for the 2% raise because it's really rough right now. We waived it for 1 year, and now the year is over, and we want to try to get that back in the health plan. They say there's no money. I understand that. There got to be some money. It's $30 million somewhere. I don't know where it went, so we need to know.
I'm here to talk about the single parents who are working and have to deal with this medical increase. That's what I'm here to talk about.
And what is the situation for single parents? Why don't you talk about it?
Well, for instance, my daughter has scoliosis, and THC, there's no way that they could pay for her surgery. There's no way. I had to get off of THC's medical and get on food stamps and Medicare.
A lot of people don't know me, but my name is Bob Pruitt. I started working with THC back in November '06. Great company, great benefits starting out. I've been ran over by a few people that I work with, and I have a wife, and she suffers from stress disorder. I had put her on my benefits, and now I have to pay for all of that myself, and I can't handle that and pay for a house too. And right now I'm under the situation of losing my house. So if I lose my house, I mean, what am I doing? I'm spending a whole lot more money to find somewhere else to move and all this. And the other thing is that she's stressing over me being attacked by even co-workers, which you know what my situation was of accusations that were brought against me, which I was not guilty of. But that has no mean about that. But I'm saying that the situation with her having a stress disorder, worrying about me being at this job, and then me having to pay full benefits instead of having help with the benefits, I have to take care of her too. So me, myself, I feel that it's unfair to me, all of the co-workers, to have to go into this situation where we have to pay our own benefits, and we work for a great company, and this company that we're proud of working for, where's the pride? We're losing our pride.
Yeah.
You know, we want to keep Randy Shaw happy. We want to keep you happy. We want to be happy. We want to have our families happy. So without having the ability to take care of ourselves with help, where do we go from here? You know, people are losing money. They're losing homes. The kids are stressing. The wives and husbands are stressing. We need to change this. And I believe that there's money. If we can open new hotels, why can't we shut down some of that and add some money to our pockets to help us out as a group of workers? Because we work hard for you guys.
And mind you, is that desk clerks, I got 5 children and 3 grandkids. Krista, no. Okay, I work Christmas Day. I work New Year's Day. I work on, my kids' birthdays, on holidays. I work. So, because I'm a desk clerk now, so, and that's stressful, and then dealing with the tenants that we got to deal with. It's not an easy job, sitting there. We got to kind of be, as a desk clerk, we got to be case manager, we got to be therapist, we got to be, security. We have to be able to multitask and fill in many roles as just being a desk clerk. So, just keep in mind that too, because it's hard. It's really hard.
Just to add,
it's none of my business, the economics of THCs, until they say they don't have any money. And I've done my own little bit of research, and I read in a Chronicle a couple of months ago that THC got a large sum of money for 3 years, and that's not counting the money they got from the federal government or the state. Last year, the maintenance department, the month after our budget came out, all of a sudden they had no money. They said no money. It's all gone. There was no money. Then at the end of the year, they came up with $60,000. None of this is any of my business until they start saying they don't have any money. At that point, then I want a full accounting. I don't want a one-page sheet saying, this is, how much money I got in my right pocket, this is how much money I got in my left pocket, and this is how much money I got in my rear pocket, leaving out the fact that I got a right rear pocket and a sock and a hat. That's none of my business until they say they don't have any money. And at that point, then I want a full accounting. I want real accountants. I don't want, you know, the union coming in and saying, well, this is how you do an accounting, and, you know, you guys go for it. And then we get boxes and boxes and boxes of information. You know, my wife's an accountant. You know, it's complicated work. You've got to know what you're doing to be able to find out what stuff is. And they can put so much bullshit on us, it'll take us 10 years to figure out what the accounting really is. But I've had people, since I said this in a past union meeting, I've had people come up and tell me about properties that THC's bought in the last few years, apartments, condos, business, real estate that hasn't been registered with the city. It's still out in limbo, so it doesn't show up on the books. Again, that's none of our business until THC starts saying we don't have any money.
We, the undersigned employees, call upon Tenderloin Housing Clinic to restore 100% employer-paid health care benefits and reinstate our longevity increase. We are concerned about the impact of high health care costs with no annual raises will have on us and our families. We request Tenderloin Housing Clinic to look more closely at the budget to find savings so that we do not have to carry this financial burden. The mission here at THC is to prevent tenant displacement, to provide comprehensive assistance to low-income tenants. By THC adhering to our demands, we can retain our qualified staffs, which in turn will improve services for the tenants. If THC's staff is satisfied, then this will lead to satisfied tenants. The undersigned THC union representative employees stand united for a fair and decent contract and will not accept anything less. So what we're asking, Krista, you and Randy, is if you will give the workers, the backbone of this organization, a fair and decent contract.
I think some of the statements that have been made here are not actually accurate. We didn't buy the Mayfair Hotel. We don't buy any of our hotels, actually. We lease them. That was a contract that the city and county of San Francisco put a request for proposal out. We applied for it and we got the contract. The funds we got are for that hotel. Those were funds that the city had. Any nonprofit could have applied for it. It could have been any other nonprofit that could be running that building. So just to sort of let you know that it is a little more complicated than that. I don't know about other properties THC's buying. I'd love for you to give me any of that information. I don't want to spend my time us going back and forth about that stuff. I do hear you, though. I do hope that the union's been very clear that we've made lots of movements in negotiations in terms of, you know, putting money towards the medical share of cost. Movements to cover all additional share of costs this year. So, you know, our proposal would look exactly the same as last year in terms of what employees would pay for their benefits. So I hope that everyone knows that's our current plan on the table, that THC has made movements, made different business choices so that we could absorb the share of costs that would have been passed along in our original proposal this year. So I hope that you've communicated that to everybody as well.
What do we want? Healthcare. 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 We'll be back. We'll be back.
I hope they're successful. I hope that they will do the right thing. In this day and age when people are cutting back on health care and we've been fighting for universal health care, to go backwards doesn't make sense.
And Randy Shaw has also fired some people here. What's going on with the firing of workers, Nathaniel Holmes?
Well, I think that he's a kind of heavy-handed leader, and and that seems to be running rampant, at City Hall and everywhere else. But I think the members will prevail. Well, not being fair. I mean, things like trying to take people's health care away. In this day and age, the way the economy is outrageous. And then they get contracts for new buildings and stuff. But in the meantime, sometimes you have to take care of home.